Hi, my name is Shamas Quince, and this is my presentation on cerebral palsy. I just have a little quote for you guys to starting out. Children with disabilities are like butterflies with broken wings. They are as beautiful as the rest, but just need a little help spreading their wings. What is cerebral palsy and what is the cause of this disorder? According to the American College of Sports Medicine, cerebral palsy is defined as a non-progressive laceration of the brain occurring before, at, or soon after that interferes with the normal brain development. Cerebral palsy is caused by damaged areas of the brain that is in control of coordination of reflexes, muscle tone, movement, and posture. The impact on the reflexes and muscle tone depends on the extent of the injury and location within the brain that results in what type of CP the individual has. A diagnosis of cerebral palsy, which, as I said before, is also known as CP, at an early age is very important. Diagnosing CP can take a numerous of steps, but there are 3 specific steps that can be taken to help to diagnose CP. Developmental monitoring, developmental screening, and developmental and medical evaluations. During the first step in the process, which is developmental monitoring, this process, the doctor pretty much watches the child's growth and development over time. They watch how the child moves. They ask the parents if they have any concern if the child about the child's development as well. Developmental screening. And then as part of the process, short test is given to see if the child has specific developmental delays, such as movement delays. When a child is about 9 months of age, many issues can be seen involving movement. And last but not least, developmental medical evaluations. This is the ultimate goal of the part of the process is to diagnose the type of disorder that affects the child. Since many children with CP have also related developmental conditions such as seizures, vision, hearing problems, it is important to evaluate the child. The types of cerebral palsy, it is predominantly exists in 2 forms: spastic, which is about 70% of cerebral palsy, and ethetoid. The most common type of CP is known as spastic cerebral palsy. Spastic cerebral palsy is broken down into 4 parts. Hemiplegia, or diplegia, is one arm and one leg on the same side of the body, or both legs are affected. This is the most common type of spastic CP. Monoplegia, only one arm or leg on the body is affected. Quadriplegia, both arms and legs are affected, and usually the muscle that controls the trunk, tongue, windpipe, and mouth are affected as well. Especially for babies with spastic quadriplegia, they may have a weak or short cry, or have problems sucking or swallowing. And triplegia, either both legs and one arm, or both arms and one leg are affected. Interesting information about cerebral palsy, just to go over a few. About 1 in 10 children identified with cerebral palsy walk with using a handheld mobility device. It is the most common motor disability in childhood. Many children with CP have one or more additional condition or disease along with cerebral palsy, known as a co-occurring condition. For example, about 4 in 10 children with cerebral palsy also have epilepsy, and about 1 in 10 have autism spectrum disorder. The rate of depression is 3 to 4 times higher in people with disabilities such as cerebral palsy. Special considerations for exercise testing. During this time, a functional assessment should be taken or medical clearance should be sought before any physical fitness test. All testing should be conducted using appropriate adaptive equipment such as straps and holding gloves and guaranteed safety. Using caution when testing individuals with cerebral palsy because underlying conditions may be present such as hearing and vision impairment or intellectual disability. Consider level of comfort and positioning of the patient when using adaptive equipment to avoid primitive reflexes and unintended increases in muscle tone. Special considerations for exercise testing. Generally, it's similar to healthy adults, but Training to develop muscular strength and endurance is very valuable in patients with cerebral palsy, being that the limbs are affected, and especially the lower limbs are affected. Resistance exercises are designed to target weak muscle groups that clash with hypertonic muscle groups to improve strength. To avoid post-exercise pain, upright stepping is practical and safe for individuals with CP. Before introducing open kinetic chain strengthening exercises, always check the impact of primitive reflexes on performance. Fit recommendations for individuals with CP. Typically for aerobic exercises, you want it 5 days per week with moderate exercise. Intensity, about 40 to 50% of moderate intensity, progressively increases to about 50 to 80% with recovery periods in between. The time, you want it 30 to 60 minutes of moderate exercise, or 20 minutes of short bouts that can be accumulated of moderate exercise based on the patient and the severity of the patient. You also have the option to do 20 to 60 minutes of vigorous intensity exercise. The types of exercise should involve the major muscle groups and is constant and rhythmic in nature. Resistance and flexibility exercises should be incorporated as well. For resistance and flexibility, frequency 2 to 3 days per week for resistance, but of course not non-consecutive. 2 to 3 days of flexibility training as well. Intensity, 40 to 50% of light to light intensity. 60 to 70% of moderate to vigorous intensity, and 50% of light to moderate intensity. Flexibility, stretch to the point of feeling tightness or slight discomfort. There's no specific duration of time that has been recognized for efficiency during resistance and flexibility training. So it really kind of all depends on the patient and as I stated before, kind of the severity of their condition, of how long they can handle resistance and flexibility training. The type of resistance training, resistance exercise can involve the major muscle groups, of course. Exercises that target agonists and antagonists, muscle groups are recommended. Single joint exercises that target muscle groups may also be included. And a variety of exercise equipment and or body weight can be used to achieve these exercises. And that is my presentation. Here's my works cited, and I hope you guys enjoy my presentation on cerebral palsy.